When a patient walks into your room, normally they have an image of what they want to look like, or they come in with an Instagram picture. And the Instagram picture is usually of Kylie Jenner's lips, or J-Lo's jawline, or something of a celebrity that they've seen. But that might not suit the patient. And what we need to do is we need to assess the patient correctly to identify what is their strongest feature and what is their weakest feature. Now, there's something called the gaze analysis. And the gaze analysis is when you look at someone, you look straight into their eyes, and then you look at their teeth. And then the next thing you do is you look at the shape of their face. And the last thing you do is look at their nose and their lips. When someone's looking at you, they're looking at your eyes. So if you look tired, that's the first thing they see. So what I do is redirect and educate the patient that actually we freshen you a little bit under the eye. Suddenly your eyes will pop up. The reason why you have hollowing in this area is because as you age, the fat pads move down, they migrate from over here down to here, causing a little bit of a fold, and then down to here. And that's why we have loss of definition here and this kind of shadowing happening here. And you're not directing all attention towards the lips. And the last thing someone looks at is the light hitting you on the nose and then the cupid bow. You normally find that the makeup artist will come here and they'll do a shade over here. Then they'll shade you on the jawline. Then they'll turn around and they'll cover the under eye. All this kind of contouring is typically of the way your doctor should be assessing your face and then attempting to contour it correctly. When we walk into a room, we want to look elegant and unique. Now, to assess the selfie side, what we're gonna do is, if you turn, that's it. You can see she's defined here. This is narrow and this cheekbone is elevated. The corner of the mouth is not depressed. If you turn her to the other side, you can also see that this distance is wider. The corner of the mouth is slightly depressed. This is heavier, this fold is heavier. So this is your selfie side. So if I know her selfie side, my job is now to correct this side to match this side. And now she's symmetrical and the light is hitting her correctly. So all her features stand out symmetrically and she looks fresh, but she doesn't look done. She looks contoured correctly. And what doctors tend to do incorrectly, which is what you need them to stop doing, is they tend to inject medially. Smile. Women spend their whole lives trying to lose weight. The last thing you want to do is look chipmunky or cheekier. So the first thing you want to do is actually look a bit more model-like. So you want to lateralize the cheekbone. Okay, the lips. The lips have been previously injected, and the lips is a really important area to talk about because young girls are going to get their lips injected everywhere and every day now. Normal lip anatomy should be 1/3 to 2/3. So if I turn to the side, you should actually see the outline of my lip. It shouldn't be like this or like this. 50-50 is nice if you're not contouring anything else. So you have to pick between the lips or the cheeks. You can't have both. The other thing about lips is never inject into the corners of the mouth, because if you do that, it can never come back. Good lip filler or good injection technique should feel like your own lip. You should not be able to feel any lumps or bumps, so you can see that her top lip is projecting over her bottom lip. So the practitioner or the doctor hasn't compensated this correctly. Now, if I did that and I volumized her bottom a little bit more, suddenly she looks a bit more proportionated. The other thing you have to look at is lip symmetry. This is wider than this side. So I have to come in and correct the asymmetry of the lip. A really popular thing or a really popular area nowadays is the nose. You can also, with a little bit of Botox, reduce the nasal flare, which is what I have when I smile, so that your nose stays in exactly the same plane when you're smiling. But be very careful of injecting up here, because yes, it looks great from the side, but front on, you're actually causing your nose to look a lot bigger.